and to the UN in Geneva. He's been one of the biggest supporters of innovation, both in his previous life as the Minister of Health of Kenya and as the ambassador here. He's the man that we all go to for wisdom on how to bring innovations into countries. Ambassador, very, very grateful to you for being here. We're going to ask you to cut to it, everyone here. We have a we might actually need to come this way. It's all it's the proverbial red ribbon. We know that we need to cut that. Thank you. Thank you very much for joining us. So we are just going to invite. We'd like you to say a few words in us here.
Let's close. Let's move closer. Thank you. Well, first of all, thank you, buddy, for inviting me to this event. Also, thank each one of you for being here this morning. And saying this morning to you. Let me thank the organizers of this event, which provides important avenue letters, funders, and the healthcare providers. Indeed, when you look around the area of innovations, it's really an indication of what we are doing globally to ensure that as we move forward, access to health is really an guarantee global development agenda. Also, wish to thank the collaborators who have been working differently. That is Health Innovation Exchange and Oxley, who are partners in many countries, in ensuring that people will access health through innovation and technology. At a personal level, I'm deeply delighted because I want to note that this event also showcases what is happening in one of the counties in Kenya, Geneva County, which is one of the 7 counties, and is able to showcase how the county is increasing access to something compared to the community through innovation. I'm also delighted with this ourselves. We have several governors who had outings in Kenya who are here. And I believe as we move to scaling up of that innovation, they will become the better. I believe the interaction we have had and we will continue to have during this forum is going to enrich the link between the aspects, partners, and also providers. I think we need to hear each other. We need to hear each other. How we also acknowledge the government who is the one pioneering that starting the exchange. And besides this, we all agree that innovation in healthcare are essential components of the pursuit to ensure that everyone has the highest attainable standard of health. We are also aware that it is not easy for any country, be it developed or developing country, to provide this entire population with the all needed health services at the hour of need. very different. Accordingly, the private sector has an important role to play in closing the health gap as it contributes financial resources, innovation, and expertise to complement public investment and governance. The governments will ensure they can provide care effectively to the populations if they embrace innovation. There's no way we are going to attain the national health coverage in our countries, developing countries, middle-income countries, island countries, embracing innovation and technology. The enable such a collaboration and partnership to succeed. There's need to invest efficient time and capital to innovate, to test, and to scale up those innovations which are going to mature and can be used by the healthcare system. In our experience, we recognize the value of innovation positively impacting human aspects of health. First, we can innovate to change the ways consumers buy and use healthcare. There are a lot of systems which are coming around, innovations which are coming, which assist communities to interface with the healthcare system. Second, motivation to economy and development treatments. We have had here, such as recent advances in mRNA vaccines. We saw how the world came together through innovation and research, produce vaccines in a record time. So anything is achievable. And the private sector needs the space, the partnership, and the embracing by the public sector to allow them to unleash their potential, to be able to input their understanding of our healthcare system. And thirdly, innovations develop new ways of working that are more efficient and cost effective in the long run. Data is very key. Therefore, a lot of innovations coming around, which we need to embrace so that we can drive the whole system, helping people instant to make innovations. Kenya is now used to partner with a diverse set of stakeholders, such as Health Innovation Exchange, Roxy, and Geneva, to improve access to and the quality of health services available to Kenyans. In recent years, a lot of innovations have been embraced by the government in our pursuit to improve efficiency, effectiveness, and availability of healthcare. As we strive towards universal health coverage, it is important that these innovations are shared with all countries, particularly those that are low and medium income. Therefore, I want to encourage the university. At the moment, they might look out of reach of poor countries, but these tools are going to become very beneficial. According to the 2022 Kenya Innovation Index, Kenya performs above the regional average of 6 points, namely institutions, knowledge and technology outputs, creative outputs. In this respect, Kenya will continue to annually adopt innovation in furtherance of our pursuit of better health. Ladies and gentlemen, as we continue to learn the lesson of the COVID-19 pandemic, global health leaders, governments, and public and private sector players must come together in solidarity to build a stronger global health system. As they strive to build a more inclusive and safer future. Doing so must include an element of performance monitoring to ensure patient outcomes are improved, available resources are optimized, and we record better health indicators in the capital of investment. And therefore, the experts commitment of the government of Kenya to support partnership and accelerate progress towards the goal of universal health coverage. Scaling up of this project that is in Wayne County, other counties as well as the expansion of scope and already supporting the outside institution. This strengthening of partnership with various players in the priority and the current administration. It is released in my His Excellency President William Samoei Ruto will host the Innovation Week 2023 from December 8 to 4 in Nairobi. I want to invite you all to come to that innovation week in Nairobi. That is December 4th, 8th. We are all invited to participate and details available to the university. In closing, I urge you to take a keen interest in the various innovations, interactions, and this you will see that you will see today be part of shaping a healthier and more equitable society. So what you are doing here today is significant to us. The exposure you are giving us by applying the patience of the innovators to consistently engage us. Sometimes the ideas look dead, but soon they are going to develop in our healthcare system. I beg you for this. Thank you.
Thank you. Thank you very much. One of the come to Nairobi very soon, so we've invited you to open the door for us, so we'll be there. And we'll be very, very happy in any way to bring you in the latest that space. Maybe just for those of you who are on the panel and who are speaking on the lowering barriers, we need to move in because the session is going to start in a few minutes. Meanwhile, the person that has touched more innovators' lives and transformed innovators and innovation and started investing in innovations even before it was fashionable. The one person that has inspired all of us is Peter Singer. He was the CEO of Black Challenges Canada, and he's now the special advisor to the Director General of WHO. He's the one person who's driving innovation both within and engaging countries. Peter, I've been very honored to know you and thank you for all your support. I'd love to hear a few words from you.
Thank you so much, Pradeep, Ambassador, Excellencies. Listen, the feeling is very mutual. I just wanted to start by really a shout out to the Health Innovation Exchange and the work, Pradeep, that you're doing to bring innovators together with countries to achieve scale, to achieve impact. So congratulations on that. And a big thank you to the sponsors as well. Listen, what problem are we solving here? The problem we're solving is that the SDGs are so important, but lagging behind. The WHO released data on Monday that shows that of the 1 billion universal health coverage target, we've reached 477 million people with access to services with no financial hardship in a 5-year period. That means that we have to at least double the pace on universal health coverage to achieve the Sustainable Development Goals. That's not an abstract thing. You know, you say SDGs, people's eyes glaze over. I want you to think about the baby who doesn't have to die, the mother who doesn't have to bleed to death, the person with mental health condition who doesn't have to suffer. That's what the SDGs are about. That's what universal health coverage is about. So then the question is, okay, well, how do you double the pace? You could probably increase by 10 or 20% the pace by thematic approaches. Little more focus on PHC, little more focus on workforce. All these things are vitally important. They're necessary, but not sufficient. If you really want to double the pace, you have to innovate. You have to do things differently. So then how do you do that? Well, all you need to do is take a few of the examples in this group of the innovation pipeline that are reaching, let's say, tens of thousands or hundreds of thousands of people, combine them with your country platforms, for example, in your country of Kenya, Ambassador, or at the subnational level in Makueni County, which has been a leader, or anywhere in the 194 countries that are member states of WHO, 150 countries with country offices, and tap into the demand of the health system and the communities, because you can't put the spring. So the vision here is take your innovations, link them to these countries, accelerate universal health coverage, save the lives of mothers and babies, and change the world. And that's what we're all here to do. As a practical matter and in closing, let me again just thank you, Pradeep, for bringing us all together. Let me acknowledge, thank you, Pradeep, thank you. So let me acknowledge my brother, Mordred Kitty, who's been with the WHO Innovation Hub, who can help link the work that Pradeep is doing, which we fully support, with the country platforms right around the world. Every country has a WHO representative or some WHO representation. And I'm convinced, having worked both sides of this street now, that the innovation pipeline alone will not go to scale. The country platform alone will not have the innovations. And I'm talking about domestic innovations primarily, as well as those from outside the country. But together, that's how we double universal health coverage. That's how we reach the universal health coverage, sustainable development goal, and all the sustainable development goals. And remember, think about just the one baby with pneumonia, the one child with pneumonia who's hypoxemic, who does not have to die because, for example, they got solar-powered oxygen as an innovation, which we were just talking about. So thank you all, and please go and do it, because we need your leadership and inspiration to keep this going. Thank you for being over here.
Thank you very much, Peter. How many of us are innovators in this room? That's fewer hands than I thought all of us are, right? Okay, we have 2 doors that are open. Okay, this is amazing. First door, we have been invited to Kenya, and that is really important because when we look at innovations, we need to work in country. We need to work with people who are actually delivering the services and making sure that that is reaching people. The second door that is open is what Peter said, WHO. We need WHO, and Moderate, my brother, is here. He's disappeared because I'm sure he's innovating with some people and looking at how we can take innovations into countries. We need to work with the country offices. So that door is open. Really appreciate those 2 invitations. This is what is really transforming access to healthcare is about. It's bringing those connections. Really appreciate it. What we're going to do is we have 2 parallel conversations that are going to happen. There is a conversation inside, which is going to be looking at how do we break down the barriers for scaling investments and access to healthcare. So please do join that. And we have another very interesting conversation that's going to be here, which is looking at innovations and looking at innovation stories and how can we scale investments in that. So please do join us. Over the day, you'll be meeting several people. What we want you to keep in mind is, 1, look at how can this conversation, because innovation is really about breaking the barriers, okay? So we really want you to use as innovators, get out, speak to people and speak to each other, because we have the pieces of the puzzle. When we all come together, that's when impact happens. So thank you very much. Thank you, Leslie. Thank you, Peter. Joanne, over to you, because you're the moderator that does it so beautifully. Over to you.
No, thank you so much. And if our panelists could join in the panel.
For those of you who are going to breaking down barriers, please get inside. The door is open.
Okay. Thank you so much. And thank you for those that actually made it live stream session. And to those in the marketplace for now, if you could quiet your conversation. And if our innovator could join us. Come on down. So thank you again. And thank you to those who I see a lot of spaces from, we've been having a lot of discussion on innovation. And I so apologize if the people in the marketplace can find their conversation. Just to be cautious for people that are listening via the live stream. We'd like to begin with, I heard your story, which is really compelling. And I always like to focus on the person and how that transforms. Because we always talk about different funding methods. Like how can we fund the innovative? How can we take the innovative scale through technical assistance? But we often miss the personal journey that a lot of women innovators take along the way. And one of the things that I find the most compelling after hearing it is not only are you successfully doing it, but you've also managed to create a network where you're able to take it to the next level. So can you tell us a little bit about your journey as an innovator and how that can be done? A lot of the partners here, and we're thankful to be here with you as this guy and you, is that women in science and technology are so key and sometimes so in innovation. So can you tell the audience a little bit about your personal journey and how we move forward?
Thank you so much. It's really an honor to share my journey as an innovator and as an African entrepreneur running an African health company platform. So it's been that's a tough journey, not necessarily tough, because probably I managed to build up my business at the right time when now people are really focusing on health innovations because we're pandemic and how it exposed the unavailable healthcare challenges across Africa. So my name is Bailey. I'm the co-founder and chief product officer at Zurina. Zurina is an African healthcare company currently live in 8 African markets since I launched 2 years ago. And our goal is to actually provide affordable and accessible healthcare solutions to everyone, anyone with a mobile phone, without being biased from who can afford healthcare. So it's actually built for everyone because we understand that access to healthcare is a fundamental human right. So the journey of building very well started in January 2021 when we set out with my fellow co-founders to build a product that will actually link healthcare providers to patients. And why they use this thing so that millions of people in Africa don't have access to basic affordable healthcare. And when we talk about basic, think about preventive healthcare. Think about quality information about their health. So right now, if you live in places like Nairobi, you can have access to doctors, you can have access to pharmacies, you can have access to labs and diagnostic centers. But when you go into the deep rural areas, you don't have friends who are doctors, you don't have anyone to reach out to, you don't have a smartphone to even Google your symptoms about what you're suffering from. So we thought about, how are we actually using technology to solve this problem? There are very two key problems. One is the cost aspect. Most people live below $1 a day, so they cannot afford healthcare. Even if you can afford healthcare, you need to think about where we get transportation from the nearest health facility. Then there's the aspect of distribution. So we see a lot of healthcare providers in our city, but they live out people in rural areas. And these people in the rural areas make up 70% of the population. So if you're building a product that wants to solve the healthcare problem, are you really solving to the right people, for the right markets? And how are you actually providing access so that they are able to meet you at the point of need? So what we did is we went back and found out how are we able to get this technology. And for us, we understood that when you talk about healthcare, it's something that you actually need. It's not a luxury. So we wanted to meet our patients at their point of need. So we thought about not just solving an innovation on a smartphone or a mobile app. So we thought about various channels, how you can access healthcare through your mobile phone or a mobile app, on a WhatsApp chat, where you can chat with doctors, you chat with your family and friends, or SMS text, because we understand that people have some most problem mobile phones, so you can actually have interaction and everything with the power of telcos, and then we also have our website. So what happens is we build out an all-inclusive and comprehensive mobile health solution where we plug in telemedicine, pharmacy delivery, lab testing, and aftercare management. So what this means is our patients are able to start and end their healthcare journey on one platform. So you can chat and consult with doctors, you can buy medication, have it delivered to your doorstep or wherever you are. You can book for a lab test, someone comes to your house, picks up the sample, and you get your results by the email. So this makes the logic of you thinking about, how you're able to get access to this healthcare. So you can access this healthcare virtually, and we are also able to manage people with even chronic care condition. Because what's found out is most people who are in the rural areas, usually they find out too late that they suffer from a specific condition. So how are we able to onboard these chronic care for patients to a continuous care program? Because when I think about, most of these people are one chronic illness away from bankruptcy, and we need to find out how we're able to leverage this. So when we started building it out, it was very interesting because we launched during the peak of COVID-19, and everyone was like, you don't understand how the virus works. They're like, okay, you're diabetic, you're this, you're more prone to getting this infection. And as we were building the telemedicine platform, my co-founder got diagnosed with diabetes. And he was lucky enough that his wife was a medical doctor who actually informed her to actually request for someone to pick up the lab sample at home without him going to the hospital. So the question was, if this is actually legal, that someone can come to where I am, pick up my sample, why can't I build an all-inclusive platform where I just don't need patients to doctors, but I also provide them the opportunity to be able to do lab tests. And remember, something very interesting, in Kenya, we have a lot of pharmacies that have built rails with the last mile distribution. So think about how you order your food on Uber Eats, on Global. So how you're able to also order your medication and have it different. So we plug in all these components and we're able to scale. But this solution was only focused on the specific niche of people, the people who have smartphones. But we wanted to leverage as well how we're able to reach the 65% of the population without smartphones. And because we have a vast background in telco space, we're able to partner with telcos. So these are mobile operators acquiring from telco, and they're really, really good with the last mile distribution. So how we do it is we onboard them and they're able to give us access to the subscriber base, and we're able to provide our doctors who provide fast level medical consultation and text. So this actually solves the problem of preventive healthcare. We're able to chat with the doctors for as low as 10 US dollars, cheaper than you going to the nearest health facility, and over that you're able to get daily health tips. Very interesting because you're really for the airtime, one of the ways, and the mobile money transaction that you built in Kenya. So we're lucky enough to now expand to across 9 African markets, and we're going to look to expand into more.
Thank you so much. And we look at how we keep them modern. Really comprehensive. You are trusting that the delivery to the mobile. Wanted to move to the knowledge of the CCI. Together, women population. And I just want to go over to you, some wisdom on the innovations in the state, really what's needed in innovation for women's cancer. So we're working with those around the innovators, yesterday, available financing, literally because
I'd like to kind of focus on telling the story of what a certain degree of like progress we've made here in cervical cancer and breast cancer, thanks to innovations. It's in these realms is where we would like to go. So certainly we made major strides in preventing cervical cancer through the introduction of vaccines, preventive vaccines with HPV. And now we're trying to develop standards of vaccination through Linda's schedules, as well as vaccinating boys and stuff. We've also made strides in the diagnosis of cervical cancer and developing point of care tests, whereas we do diagnostics. I'd like to see those cheaper and they we've expanded the opportunity to treat breast cancer through remote development of urban collaboration devices and being able to bring the cost down. Yeah, we're working on triage, continuing through AI, and so there are a number of exciting innovations coming together. We're trying to also improve access to treatment for many medical patients. So there's some exciting innovations being made on the fusion. We're using data with radiation treatment plans, innovation to improve status treatment time for radiation. We've also been collaborating with several imaging breast masses, most breast masses, and so there's some very lots of approach down. Those handheld ways to diagnose the timeliness of I have seen well, that's that might be yes, and so we're excited about the progress that's made in terms of being able to do diagnostic tests for cancer versus heart cancer, for estrogen receptor, progesterone receptor positivity, positivity on a very limited testing of that. Near point, similar information in delivering low costs, local radiation therapy for other states. So you see the terrific progress both in the cervical cancer and breast cancer. And look forward to making more progress through some of the exciting innovations that we see here today. So
Thank you, Dr. Ted. And I think one thing that brings us all together is that we can come from it in renewable energy, agriculture, water, but the innovation space of how we work in the deployment, both acquiring the financing, taking through the journey, and also working with governments on the ground. And those governments are also helping us on science, health, and technology is so key. And so with that, I'd like to turn it over to our co-host from SCPU, CRDF Global, in terms of the thinking around, what is the SCPU and our conversation here on women, health, sciences, technology.
Joanne, and good morning, everybody. I'd like to start by echoing some of the remarks made earlier today about the importance of achieving the sustainable development goals. And with that, I'm Carla. I'm here on behalf of CRDF Global to represent the Sustained Dialogue on Peaceful Uses. The SDPU is a new jointly funded initiative by the US and UK government that came as a result of the Non-Proliferation Treaties Review Conference. Its goal is to strengthen the third pillar of the NPT, so peaceful uses of nuclear technology. And what we're doing is we're aiming to build a bigger table around the conversation of nuclear technology and how we can use nuclear technology to achieve those sustainable development goals. And in doing so, we're also complementing the work done by the IAEA Nuclear Peaceful Use Initiative in 3 thematic areas: food, climate, water, and healthcare. So we are currently having an event scheduled in July in Accra to enhance access to nuclear medicine in West Africa. In this event, we aim to bring stakeholders to the table, including policymakers, public and private sector, industry, and importantly, the greater international development community. And we're doing this to address some of the challenges in public education and awareness, equipment maintenance, workforce development as it relates to cancer care, and more importantly, find those actionable solutions.
Thank you so much, and we look forward to bringing more people. I'd like to again turn us back to the innovation lens. I know you've spoken to my colleagues in terms of, a lot of the great work you're doing in this sector. Return again to the question on your kind of where are you now, and how are the partners that too?
Thanks so much. Great to be here. I share a lot of the thoughts that have been shared before by you. I'm Manos. I run Multiwave Technologies. Multiwave is a medical imaging company. We have been in the field of nuclear imaging. Specifically, we're looking at devices that can help democratize medical imaging. Many of the devices that you are very costly, confined to hospital infrastructure. With MRI, it's the reason I'm confined in one of funds, so it has to be somewhere as infrastructure. So therefore, rural areas for countries that can afford MRI that costs several $billion, fund a lot of countries, maybe in Africa, but also elsewhere, developing countries with very low density of medical imaging modalities in general. So ultrasound is the most widespread because it's light and it's becoming more accessible. And we're trying to do the same with MRI. So our mission is to democratize magnetic resonance imaging. The advantage of MRI is that it's non-ionizing. And we have developed a device that weighs just 200 kilograms, very light. They can roll on non-motorized wheels, plug them with standard wall objects, and you can use them virtually any clinic, and you can see the matches with both of the previous speakers about using telemedicine and logic platforms. We're very interested in that. And of course, you speak about medical imaging when making more accessible. You cannot have multiplication radiologists and medical issues everywhere. So you need to rely on one person. You know, as much as possible. And these systems can be widespread now. So the messages trying to make more accessible. We're trying to increase the amount of people that have access to all diagnosis, but also preventive medicine. And also, of course, men, women, and children.
Thank you. It sounds like technology can be placed within a healthcare ecosystem without a market structure of how to do that. I'd like to ask a quick question and turn it over to our expert audience. And I see others here to ask questions for innovators. If you had unlimited resources as an innovator, what would you do over the next year?
If I had unlimited resources, I'm already smiling because I wish it happens or I wish it passed through. I think there's so much that I'll be able to do because my goal is to actually scale and build out a lot of things, bringing on board partnerships, plugging in a lot of key players, and even just being able to, acquire something. So in terms of looking at ways in terms of market expansion, I'm looking at getting the right team hires, bringing on board partnerships, just being able to collaborate with a lot of people. If I had unlimited resources, I'd be a unicorn right now because the things I want to do in terms of healthcare, I'm just thinking about how we can able to actually just give a lot to the medicine at the moment. But leveraging that and also getting more funds towards building mobile bus clinics. So mobility is very key. Sometimes we focus about, taking the patient to the hospital, but why does I keep saying mobile hospitals to the people in the villages? So there's so many things that we can do. And when I look at painful insurance penetration rates, how can we be able to build products that actually are able to bring people to acquire health insurance affordably? So I'm thinking about how I'm still able to leverage on my current innovation with the FMX service, the telco, being able to lend people airtime in exchange for their health insurance. So there are a lot of things I can think about, and it's exciting. Very soon.
Thank you, and hopefully, the partners around that will to help you scale. What about yourself?
I would say there are two things to unlock here. The first is regulatory approval. So there are several methods You get the A's, you get the opens to those doors, and you see margin, and another margin is way up. So that's the first one that you do. Without that, you cannot do anything. Then the second one I would like to have is bring on board as many insurance companies. What's key in developing a system that is sustainable is having a reimbursement that goes big. Reimbursement that is affordable. Persons complain about reducing healthcare costs, and it starts with making it not more accessible, less costly, and therefore reducing the overhead costs to society. Because when you diagnose early, you can treat early. When you treat early, you can have less people take care of it when they're sick later on. So our goal really would be to increase access as much as possible and increase the level of medical imaging in the local countries, bring it to a level that's comparable to the other.
I'd like to turn it over to the audience. I see that, a couple of people that have questions, so. It's okay, my voice carries so back if you want it. I would love it. Okay, thank you. I'm sorry, guys, I was held my. Oh, actually, I thought this was quite metaphorical. Thank you for the panels. Because in the world of healthcare, there is always a surplus of need and noise to what to put your attention to. And you have to focus on what you want to see and what you want to observe in order to really understand the problem. And I feel like we've kind of dealt with that collectively in this moment. But what I love is the focus from the panel and being able to deliver under a very noisy environment that is global healthcare today. I'm like on fire, I got notes, right? But what I was really interested in is the capacity for you guys to be extraordinary in the ordinary. And what I was thinking about was, when you think of sustainable scale, does your dream for what these innovations can do expand, throughout, not just to our most needy, but maybe to our most able to pay? And is there a place for that? Because I think that's just something I was curious as a fellow innovator. And also, I guess my question to the panel is, someone who's not a clinician, but what I do well is I can speak loud on behalf of things I believe in. So how do people like us, for educating ourselves about what you guys are bringing to the world, how can we align with your causes and help you guys push the needle forward? So my two questions are around what you envision for sustainable scale beyond our most needy, and then also if you could please comment on, capturing the eager and willing and helping them kind of point their voice in your direction.
So I'm also not an innovator or a clinician, but what I am here to do is expand this network of building that bigger table, which I think kind of comes at your second question is, if there are people eager to really hear about initiatives like the SDPU and continue to branch that network out so that we bring people who are eager, with people already doing the work, with people who have solutions, with people who know the actual challenges day to day. So bringing that all together is kind of the goal of the SDPU, and that's what the answer that I can give you as a non-innovator and a non-clinician. Thank you. Thank you.
Yes, so when I talk about building something that is scalable, I actually had to think about that when I started, market research and building the platform. But I had to ask myself, how am I able to still build something that will have impact and still generate revenue? So, and in building this, I not only build a sustainable business with a clear path to scalability, but I also look at everyone. So when I talk about my main focus is there and the South markets, I also have a solution for people who can help you. So most of the people who utilize my application online on the WhatsApp chat on the app, they are, usually middle income clients who are looking seeking convenience, and they even have health insurance. So think about how you can sell to them wellness care packages that they can run and pay with the insurance. Because what we found out is We have a lot of corporates that provide health insurance to help their staff. But after every year lapses, they barely use it because they don't have the awareness that you can actually use your insurance to run your wellness checks. So just creating awareness around this, building a product that will still leverage this, and creating them up. So bringing every system or ecosystem there for investors, the government to be able to provide frameworks around to the medicine, because that's the biggest challenge towards scale. We need the barrier of regulation. Like Africa sometimes in different markets when you're looking for expansion, it's both healthcare, sometimes over-regulated or under-regulated. That's one of the biggest barriers towards scale. So if we can actually solve this, it will be very, very key for us to about it.
Thank you so much.
I don't think Jeremy wants to add to this. I think it's important that we have to reach out to commissions and governments that are working on the projects that are relevant to you, and so we can get that. This way to go about as well as where something that unmet needs that they may be able to identify to, as well as make sure that you understand how the regulatory background funding benefits. So, don't be afraid to might want to do this. I suspect you're not. And just keep asking questions and showing up and saying, here, and we work together.
Thank you.
So, I would start sustainability comes with demonstrating clinical utility. So for us, what would be most important is to be able to install each either in the same demonstrate that people don't need rights. If you like to see this, stand it's right here. That's it.
No way.
That's it.
Everybody look out the window is pretty. That's so much more cheap than I thought it would be. This reminds me of when we had cell phones and phones, and then we started, well, and that's what made me think about the sustainable scale house, because I mean, if this is possible, it should be, it should be everywhere. That's what I'm interested in capturing from innovators today is their interest in that as well.
Thank you, and we're looking forward to see it. I think it's going to be set up here in the marketplace, so please stay for that. We'll take another question. Thank you for having sent the presentation. I'm also a listener.
And I'm particularly interested in the innovation. So I don't have the questions. What are the first slide on that? There's how many other countries we can activities, and have you considered how this can work, especially for pre-hospital care? Suppose for example, you can actually probably have very website for biologics. Trauma care centers. So have you considered how possibly work for the care centers
Thank you. So we just saw three machines so far. One in the US, one Sinai Hospital, one in the Brighton Medical School, and the third to the University of Essex. So that's only here in the US. We tested with our partner this device in Geneva, and one of the ideas is to see how people can set it up there and maintain it locally, and essentially develop the radiology platforms around and testing for different use cases. So we're testing it for hydrocephalus, for internal medicines, the diagnosis. One of the things that they're interested in is converting this for stroke detection, for early stroke detection, where you every minute counts. We use about 1.9 million neurons per minute. Stroke. So if you take a diagnosis, it's the difference between ischemia or hemorrhage, then you can also treat it. I can save lives and reduce profit assistance for treatment. So we're very much focused on research basis, emergency use, and intensive care unit.
And just to respond to the question of asking you want it unlimited resources. I mean, if I think that unlimited resources are going to teach you, ensuring that there's so many of these. Yeah.
Thank you. Thank you so much to everyone. Are there other questions? Too bad I can't call you. Well, I really, there was. Thanks, for the state, one person who's doing it. So, basically, I've worked in these days, company called so I think this here for you, when you are taking this ecosystem which completes those into the completion of each ceremony, where do you start? And what steps are you taking to make sure that the partners that you're choosing to collaborate with, they're not going out of the way and basically acquiring those based on themselves because they're based on the conference in the market, right? So how are you building that mold? I'm so your phases, and I would be very interested in hearing your thoughts. Thank you so much. Very interesting, very good question. So to address the first question, how I started this. First of all, my idea was just create and fit patients and doctors. But when I rolled it out, and so because you have a patient, a require patient, but when you get a lot of challenges, after the patient has been able to consult with the doctor, they have to go all the way to the pharmacy or the labs. So they don't have the incentive to get back to the application. But because of providing an end-to-end care journey, and I also enrolled them into a continuous care program where I manage the conditions. They more so trust my application, but I also don't, want to provide a mobile application platform. I have the SMS service. So for the SMS, everyone has a mobile phone. And because the cost is very affordable, they want to be able to get quality care at that point. And when you talk about, maintaining the customer, they don't do it alone. So one of the things is, that is extremely fundamental. And by starting at the scale of growth with partnerships. So what I've done is give them a pharmacy model, my labs model, I've partnered with clinics, partnered with doctors, partnered with labs and pharmacy central. So they're the ones who mainly do the lab, they do the institution, and I get them on board. So those are some of the incentives. And then what we do is we have that person. Because if I have your number, the only way I lose your person is probably sometimes. But because I have an WhatsApp board, I get access to you, I'm able to stay about it, I will maintain that content. And the thing is, so it's very easy. You can afford a little of water and you can afford our services. And for some of the days, we're able to bring out of here. Great, thank you so much. Thank you to those online, and thank you to our analysts. Look forward to